We'll get started right on time at 7 o'clock, so we give it about another minute and a half. Welcome, everybody. I see more and more people joining. We're going to give it about another 1 minute before we get started. All right, well, it's 7 o'clock, so I think we're going to go ahead and get started. I'm sure more people are going to trickle in. So hello and welcome to AIM at Skin Cancer's webinar series, Skin Cancer and You. I'm your host, Krista Rubin. And today we're diving into an important topic, movement and exercise during cancer treatment. And we're honored to have with us Dr. Kathryn Schmitz, who is a leading expert in this field. And she's going to shed light on how physical activity can really play an essential role in cancer care. So welcome, Dr. Schmitz. I'm thrilled to have you join us.
I'm delighted to be here. Thank you so much for the invitation.
So let's start by talking about the relationship between cancer and exercise. Why is exercise so important, particularly for patients undergoing cancer? But first, let me ask you the question, why is exercise so important, just in general?
Yeah, so let's start with just some basic physiology, things that people would notice themselves as they exercise. So when you exercise, if you go from sitting listening to a webinar, for example, to standing up and moving, you'll notice that your breathing changes. You'll notice that your heart rate increases. You may or may not notice that your blood pressure goes up as well. What you will not necessarily notice, but is happening at the same time, is that there are changes in what the blood is delivering to your muscles and to your organs as a result of changing how much you are moving, just even in a single exercise session. So the way that our body uses glucose, the way that our body distributes insulin and puts glucose into cells changes, just even in a single exercise session. The way that the body responds to an immune issue is also changed just simply by a single exercise session. We can potentiate our immune response by virtue of being more physically active. I want you to ask me about that and immune therapy later. Okay. So there are all kinds of physiologic changes as a result of a single exercise session, just simply getting up. And let me actually also state what I mean by exercise, because, exercise, physical activity, are we talking about CrossFit? Are we talking about, Olympic style lifting? Is this a clean and jerk? No, I'm talking about going for a brisk walk. That's what I'm talking about. Certainly weight training is fantastic and would be great for everybody to do weight training. And there are benefits of weight training, and I'm happy to explicate those as well. But I think that the exercise that is most accessible to the average person is walking. And so, that's what I kind of think of. When I'm saying the word exercise, I'm thinking of a regular walking program. But in addition to those acute changes that happen as a result of a single exercise session, a single walk, there are also, if you were to do that multiple times a week over the course of many weeks, what you find is that the body changes, it adapts. And so I want you to imagine, if you will, a tree a tree that is along a river, at the bank of a river, and the riverbank kind of, falls away. And so the tree is out over the river on this big diagonal. And so the tree roots are working very, very hard over here in order to keep the tree from falling into the river, right? And so if you, on the other hand, are a tree and you're straight up and down, then the tree isn't having to work quite so hard in order to maintain its own homeostasis, its own sort of balance, if you will. So those of us that live a relatively sedentary lifestyle, those of us that might be carrying a few extra pounds, are more like that tree over the river, right? So there's something working very hard over here, trying to keep our roots intact. So the body is working extra hard to try to maintain what we call homeostasis. If we exercise on a regular basis, it's almost like we're taking the tree and we're standing it straight up. And we're making it easier for the body to be able to respond to immune insults, to respond to infections, to respond to inflammation issues. Your blood pressure actually goes down as a result of being more physically active on a regular basis. Your resting heart rate goes down. So we have cardiovascular issues. We have metabolic changes. We have adiposity changes. We have immune changes. We have inflammation changes. All of these things happen as a result of being regularly physically active. So if you think about all of what I have just said, and that this is just basic exercise physiology, not even talking about cancer yet. We haven't even, the word cancer just uttered out of my mouth just now, right? So even before we talk about cancer, that exercise has all of these physiologic effects. We know that it does. We know that those things occur. Those things are very well established, and we know that those effects have a positive effect on our health on a more general basis. When we then start to talk about people who have had a diagnosis of cancer, my goodness, talk about a tree that is leaning out over the river. There's all kinds of insults that have happened in an individual who is diagnosed with cancer and is going through cancer treatment. That person is dealing with a great deal of insults to the system. And so exercise has the potential to straighten that tree back up and help people to be able to withstand the insults of cancer treatment.
I like that analogy of the tree. That's helpful. And it kind of just shows that there is benefit that you can actually physically see, but also in feel. So one of, I would say, the most challenging things, and I can think of it myself, but also what I hear from patients is, how do you get yourself started? How do you start your quote unquote exercise regimen if you're somebody that has lived a sedentary lifestyle? Or what I hear often is, I'm busy at work, or I'm busy at home with the kids.
Yes.
But
yes.
Can you talk a little bit about the difference between just being active during the day and actually having a formal exercise or activity program?
Yes. So I think oh gosh, I have so many things to say.
We don't have a lot of time, but it's
so the first thing to say is that I think that, technology is our friend here. And if you can get yourself an activity tracker, whether it's an Apple Watch, or a Fitbit or a pedometer. I mean, it doesn't have to be expensive. It can be a $10 pedometer from the drugstore. But wear it on a regular basis and notice what your activity level is. If you are a relatively sedentary person, then you are going to show that you have steps in the range of 2,000 to 5,000 per day. And if you are only getting 2,000 to 5,000 steps per day, then that is your indication that, yep, I need more. So, and the reason I start there is because there is a lot of confusion about this issue of, I'm busy.
Right.
I'm busy and therefore I'm active. And being busy is not the same as active. Now, if you happen to be a nurse on your feet all day, a FedEx delivery person, a construction worker, we can think of, there are maybe 10 different kinds of, occupations that I could name that are actually
Absolutely.
truly physically active, right?
Mhm.
But the vast majority of us think that we're active when we're not, right? So the first thing is to set the baseline and to understand how active you actually are. So
Mhm.
get yourself a tracker. If you find that you're doing fewer than 5,000 steps per day, then yep, you fall into the sedentary category. In which case you then say, you asked me, okay, so how do I start? How do I get going? And this is where we really lean heavily into work done by our behavioral scientists. And the behavioral scientists would tell us that it's really about behavioral shaping, in the same way that you don't give your 4-year-old or your 3-year-old a big heaping bowl of broccoli to try. You hand a single floret of broccoli to the child and try to see if they will take a bite, right? And then you try it again another week later, and then you try it again, and you don't like throw in the towel after they don't eat the whole bowl of broccoli the first time you serve broccoli to a toddler, right? So it's behavioral shaping is the idea of starting with something that is, no pun intended, bite size. With exercise or with physical activity, bite size would mean, are you willing to get up during the breaks in the television show? 3 minutes, 1 minute, 2 minutes. Are you willing to stand and sway? Are you willing to set a timer and move your body in any way that you're willing to move it, including the 30-second dance break, which I think is hilarious. I don't know if you all have seen this online, but there's this button you can push and it does this 30 seconds that you can just dance. 30-second dance break. Choose to park a little farther away from the store and walk a little farther into the store. Don't look for the closest parking space. There are a variety of ways to try to get just tiny amounts of extra steps. And the way that you know you're doing it right is that you succeed.
Hmm.
Okay, so that's really important, Krista. So if you find at the end of the week that you set a goal for 3 30-minute sessions of walking and you didn't get one in, the problem is not you. The problem was with the goal. You then back off on the goal and you say, nope, I'm going to try 2. And the next week you don't do any. And you say, okay, I'm trying 1. The next week you don't do any. And the next week you say, I'm doing 5 minutes. And then you do 5 minutes and you're successful. Fantastic. We like success. We feel good when we feel like we've done what it was that we set out to do. 5 minutes, 1 time in the week. The next week you do 2 times, 5 times in a week.
So set yourself up for success, not failure.
Set yourself up for success. Exactly.
Right.
That is exactly the message that I'm trying to get to.
Yeah.
So the other thing we can do is, really set ourselves up for success by putting the sneakers out, by making an appointment for exercise, making a time, setting aside a specific time to be able to get exercise done.
And making it a priority, even if you don't feel great, even if the idea of exercise is daunting, right? And before you answer that, I just want to say to the audience, please, if you have questions, submit them through the Q&A, and Dr. Schmitz or I were happy to answer them. And you were talking to me earlier about you hope people send in questions, so please submit if you'd like. But now let's go back to that. The idea of you've been diagnosed with cancer, or you've been dealing with cancer for years in some cases. How do you motivate yourself? It sometimes must seem daunting, the idea of one more thing I have to do between appointments and taking care of family, et cetera, et cetera. So what are some practical tips? Because a lot of people, it really, one more thing on their to-do list is just too much.
Yeah, again, bite-size approaches is really helpful here. The other rule of thumb that gets used in the field of exercise oncology is the 10-minute rule. And that is if you're like, I don't know that I can do this. I don't know that it's possible for me to do exercise or to walk for 30 minutes or for 5 minutes or for however long. And so the answer is to give it a go and try it for 10 minutes. And if 10 minutes feels daunting to you, fine, try 5. And at the end of that 5 minutes or 10 minutes, you then ask yourself the question, do I feel better? Do I feel worse? Do I feel the same? Because I think that many of us have become a little disconnected from what we actually are capable of doing in terms of what our bodies are capable of doing. And with that disconnection, then you can start to feel like, oh, it's just overwhelming. It's just overwhelming, you know? So the advice is try it for 10 minutes, and very importantly, check in after that 10 minutes and say, you know, am I feeling worse, better, or the same? And most people find that they are feeling better after they've done at least just a little bit of movement. And that is then the key, because success breeds success in another way. And that is, if you notice that you're feeling better after you move, then you will want to move more.
So can you expand upon that a little bit more and talk specifically about what are the things, like, how do you feel better? Are you sleeping better? Do you just have more energy? Like, what are the true benefits of exercise?
Well, the number one symptom that cancer patients report as they're going through their treatment is fatigue. And the number one intervention that we can give to cancer patients, better than any pharmacologic intervention that is available on the market for cancer-related fatigue, is physical activity.
Which sounds completely counterintuitive, right? So you're exhausted, so exercise or be more active.
Yes. That's exactly what I say. Every time I give a talk like this, I always say, so what part of I'm tired do you not understand?
Right,
You know,
right.
Dr. Schmitz, you just don't understand. I'm tired. And I'm saying to you, you know, as counterintuitive as it sounds, it turns out that moving a little bit more actually is the best medicine for cancer-related fatigue.
Okay, so let's talk a little bit about patients undergoing treatment.
Yeah.
With, you mentioned it earlier, but immunotherapy. Immunotherapy for patients with skin cancer has kind of become the standard. And so many patients are receiving immunotherapies, whether it's for melanoma, squamous cell, or other types of skin cancers in particular. One of the most common side effects from immunotherapy is joint aches and pains, and of course, fatigue, as you mentioned. So for many people, activity is challenging. Do you have any thoughts, or can you talk a little bit about how exercise may impact the treatment and benefits of exercise when you're receiving immunotherapy?
Yes. So, okay. So, I'm gonna talk out of both sides of my mouth for this answer. Okay. I'm gonna talk out of both sides of my mouth because, I want to freely admit, as I do in my book, I have a book called Moving Through Cancer. And I don't talk about immunotherapy in the book, and I don't talk about it because the book is based on randomized controlled trials. And it's based on the results of randomized controlled trials in cancer patients and the types of therapies that, that have been studied. So I want to admit that the field has not caught up. The field of exercise oncology has not caught up with immunotherapy.
But it applies to a lot, kind of the concept of cancer treatment. You can extrapolate, and something like exercise versus a medication. It really has a universal application. So I appreciate your knowledge to help us.
So there's that truth, and I just want to admit to it. But I can also tell you that we have a tremendous amount of information that can be extrapolated that is very, very relevant to the patient who is going through immunotherapy. We know, and beyond the shadow of any doubt, that exercise has a positive effect on arthralgias, which is the big name given to any kind of aches and pains in the joints. And it doesn't matter what the source of those arthralgias are. We know that it works for arthritis. We know that it works in breast cancer patients who are taking aromatase inhibitors. We know that it works in individuals with Ehlers-Danlos. We know that it works in POTS. We know that it works in many, 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 many types of physiologic, diagnoses. We don't particularly have the information in immunotherapy, but there is absolutely no reason to believe that it wouldn't work in immunotherapy as well.
Well, plus, as you mentioned earlier, that we know the benefits on the immune system. And
Right.
immunotherapy just kind of enhances the immune system. So one could really, make presumptions, so to speak, but in a way that is positive and can help patients. And those conditions
Yeah.
you mentioned earlier, the POTS and the Ehlers-Danlos are probably things people have never heard of, but they are conditions that are a bit rare and don't have anything to do with cancer. But your point being that those individuals that have those type of illnesses often have mobility or joint conditions.
Joint issues, they have aches and pains. It's more difficult for them to exercise. We know that people with arthritis, I mean, this is the area that's really so well documented. People with arthritis who don't exercise, their arthritis gets worse. We know that that's true. And so one of the things that's again counterintuitive, like with the fatigue issue, Krista, is that if somebody has aches and pains, their tendency is to say, I will move less now. And that's unfortunately the wrong direction to go. And what ends up happening is that by moving less, what we know occurs in somebody who's having arthralgias, who's having these aches and pains, regardless of the source, we know that then causes a decrease in muscle mass and an alteration in skeletal bone and muscle that actually worsens all of the symptoms as well. And so those things are extremely well documented. And so we know that individuals with any kind of arthralgias should be exercising and weight training in particular, interestingly, in order to keep up their muscle mass and in order to keep their bones healthy, and to help with, they will feel better. It's counterintuitive, but they will feel better if they're exercising more.
And when do people generally feel that benefit?
Okay.
Is it a week or 2 or 3? Because you need that light at the end of the tunnel to get you through.
Yeah. So with regard to the fatigue benefits, they're immediate. They're immediate. They're within the day, within the hour.
That's motivating.
That's motivating. That's very motivating. Exactly. With regard to the aches and pains, that's on the order of weeks. So it takes a little while for the effects to start to sink in. But the point is, you should never feel, and this is a really important point for your audience, you should never feel worse as a result of exercising. If exercising actually does make you feel worse, then you're either overdoing it or you need the guidance of a professional to make sure that what you're doing is actually helpful to you.
So that's a great point. It's actually, I have a question. I had a question about that, is like pushing yourself versus exhausting yourself. Like you got to motivate yourself, but yet you don't want to pay the price the next day. If going through the grocery store and pushing a carriage exhausts you, then, a lot of people will say, I paid the price the next day. I wanted to go to that family event. And then the next day I was down and out.
Right, exactly. So, and you do have to titrate. And so that's why one of the things that I like to talk about is start low and progress slow and let symptoms be your guide. So
Love
if
that.
you're
Love
not
that.
sure of how much you're supposed to do, then you start with 5 minutes. And if you feel better afterwards, fantastic, maybe do another 5. But that's enough. You don't want to do, oh, I feel great, so I'm doing 2 hours. That's the wrong instinct. That's the wrong instinct. You should be increasing slowly by slow amounts. 10% per week is generally a good rule of thumb.
10% per week. Okay. That's good.
So it's a little difficult at the beginning. If you have 5 minutes, then increase to 10 minutes. If you're doing 10 minutes, then you can do 12 minutes. You will increase over the course of weeks to the point where you're able to do 30 minutes.
And there's a comment here from Will who says, I have found that yoga has been fantastic for my body, mind, and spirit.
Yes.
Thanks for that, Will. I think that's, really important, especially if you're undergoing cancer treatment, that kind of whole body approach. And if you can get benefit for, the mind, spirit, and body just from exercise, that's pretty incredible. So let me ask you this. What role does age play in all of this? Like, for example, are older folks more likely or less likely to get the benefit from exercise? Does age not matter? What role does age play, if any, in exercise with with patients undergoing cancer treatment?
It plays a role in that the baseline that you're starting with is going to be different if you're starting and you're 72 than if you are 42. So, we do, as we age, we lose bone mass, we do lose muscle. Through our 60s in particular, we lose a lot of muscle. And so your starting place is just going to be different, but the trajectory of benefit that individuals will enjoy from an exercise program are equivalent for younger versus older patients. Over and over again, we keep seeing that, in fact, starting with, there were some beautiful, beautiful papers that were published, from Tufts University years ago that took individuals who were in their 80s and 90s who were completely wheelchair bound and not able to ambulate, and they did a weight training program in these folks, and many of them abandoned their wheelchairs and were able to walk again. So the sky's the limit. It's just a matter of kind of where you're starting and how far your tree is leaning out over that, over that river.
Are there any contraindications or reasons not to exercise? For example, after surgery or during radiation therapy, would there be a reason not to exercise?
Yeah, so outstanding question. During radiation treatment, exercise is perfectly safe, and there's plenty of documented benefit. One of the primary symptoms that is reported by people who are going through radiation therapy is fatigue. We know that exercise is outstanding for cancer-related fatigue. But around surgery, excellent question. So, it requires, as I know a great deal of physical work for the body to heal after surgery. And we need to allow the body to do that work. And so the real issue coming off of surgery, there's actually, I want to answer about rehabilitation as well, but the real issue coming off of surgery is not to stop moving altogether. In order to make sure that your gut is healthy and that things are moving, if you will, through the gut. And so you want to take your IV pole for a little jaunt, when you're still even inpatient. And you might decrease the amount if you've started an exercise program, you may need to decrease the amount that you're doing, but you don't want to stop altogether. The truth is that no one benefits from just not moving all day. No one. People in the ICU need to be moved.
Sorry to interrupt you, but there is a great question that's pertinent to this. As somebody asked, can you exercise when you have bone metastasis or
absolutely
spread to the bone? It's a great question coming from one of our members. Yeah. So no concern about that.
Yeah, so there are guidelines now for exercise for bone metastases. They are available online. If you Google around a bit for exercise guidelines, bone metastases, you're going to land at the University of British Columbia. They have a beautiful website on this topic exactly. There is a recommendation that you get an evaluation from a qualified professional because bone metastases vary with regard to how likely the bone where the met is breakable. It depends on where it is on the shaft of the bone and where it is in the body. And so good idea to get an evaluation from a qualified physical therapist to make sure that things are okay. But generally speaking, walking exercise is highly, highly recommended. The type of weight training you would do with bone mets really varies according to the type of cancer and where the bone mets are. So that's where you need the guidance of an exercise professional.
Yeah, that's good advice too, because we don't want there to be fractures that occur, especially if it's in something like the femur or a larger bone. So often your oncologist may refer you as a patient to an orthopedic oncologist or orthopedist just for safety. So that's good advice. All right, so as we're drawing to the conclusion of our time here, is there anything else that you feel is important? Is there anything else that we didn't touch upon tonight that you feel would be important for our audience?
I think it's just really important to bring across the idea that exercise really truly is medicine, and that it has the power of a medicine. And frankly, if it was possible to prescribe a pill that would do everything that exercise can do for you, then all of our physicians would be prescribing it very, very broadly to cancer patients and beyond cancer patients. And if you are overwhelmed by the idea of trying to make an exercise program happen, with this, restrictions of how many times a week you're supposed to do and how many minutes you're supposed to do, let go of all of that and know that more is better. That is hugely important. Every minute of movement counts and is better.
And I think you summed that up just beautifully, because really we think of exercise as, this big formal process. You have to go to the gym and, it's a couple of hours. But really what I've learned from you tonight is that even minutes, just as you said, getting up in that commercial or walking a little bit further when you're going to the grocery store, that all adds up and is meaningful and does have benefits. So we shouldn't ignore that. And we really just need to get maybe used to the word movement or activity versus exercise. I think like psychologically that's easier to accept for all of us in our busy lives, but for patients that are undergoing cancer treatment, it's daunting. And the other thing I really thought about is many patients who have cancer or undergoing cancer treatment feel isolated. What a great way to bring in your friends, bring in your family, have them take a walk with you, or have them, do some of that activity with you. That could only be a win-win, I would imagine.
Yeah, so I am a cancer caregiver. My wife had head and neck cancer, and we had a system to help us getting through her treatment called Lots of Helping Hands. It's an online, scheduling thing.
Yeah.
And I was, I was that mean lady that made her walk every day, of course. And we had appointments on our Lots of Helping Hands calendar for people to come walk with her.
Wow.
And
That's
it was a great support for her, and it was a social time for her. So I really recommend that if you have people coming to help you with other things, that you consider having people come and help you with going for a 10-minute walk.
That's great advice. Well, thank you so very much, Dr. Schmitz, for your invaluable insights. I have learned a lot just in my time doing some homework on this. And to our viewers, thank you for joining us. Don't forget to visit YouTube channel at Aim at Skin Cancer, or subscribe for more expert interviews and information about skin cancer. Stay active, stay positive, and take care. And thank you again for being here, Dr. Schmitz. Really, it was quite a lot of fabulous information. Thank you.
Great pleasure.
Good night, everybody.